The word alone can be challenging. How do we get started? Where will the change lead? Don't sit there and worry about it. Be the change. Welcome to Be the Change Radio. Host Christina Bloom has been a professional psychic and spiritual advisor for 20 years, offering psychic and mediumship readings for individuals and groups. She also teaches several classes in psychic development and metaphysics. In addition, she is an author who has published 2 books so far and is the co-owner of Moonbow Publications and Productions, LLC. Are you ready for that change now? Here is your host of Be the Change Radio, Christina Bloom.
Hi, everybody. Welcome back to Be the Change Radio. You're listening to me on WLTK-DB.com. Let's Talk Radio. I'm your host, Christina Bloom, and I'm back. It's hard. I want to thank you all for all the love and support that you've given me. I have to let you know that the paranormal room will not be on anymore. I'm so sorry. This is hard. Sorry. Just give me a minute here to gain my composure. For those of you who want to come to it, Logan's celebration of life will be May 20th. At Broadhead Manor in Broadhead, Wisconsin. The event is listed on Facebook in several different places, but you can contact me if you want more information. I knew I was going to cry. Sorry. Logan is sitting here just chattering in my ear. It says hello to everybody. So hello from Logan. We've been having a lot of conversations, so I know where he is and I know he's okay. Anyway, so he's telling me to get on with it, so I'm going to get on with it. This Friday night at the American in Ashland, Wisconsin, I will be doing a seance at 7 o'clock. You can get those tickets through Soul and Synergy. At the same American, on Saturday, there is a psychic and wellness fair, and that's from 10 to 4. Thank you, everyone, so much. Let's see. On the 24th, I will be on the radio at 10 p.m. Central with Todd and Nicole on Haunted Voices. We're going to be talking about a lot of fun stuff, so join us there. And on the 25th, I will be in Rhinelander, Wisconsin at the Quality Inn for the Northwoods Health and Wellness Expo. And on April 15th, I will be doing psychic readings from 10 to 4 and a seance at 7 p.m. at Soul and Synergy in Eau Claire. And let's see. People are messaging me on Facebook. Please just ignore the bings. Let's see. On the 22nd, I will be at Broadhead Manor for the Spirits in the Spring Paracon. On the 29th, I will be in Escanaba, Michigan. We're having a psychic fair up there. I love all you guys so much. You have no idea. Let's see. Skipping ahead to June, I will be at the Marinette Menominee Paracon and Bigfoot Festival in Marinette, Wisconsin. And in September, on the 22nd through the 24th, I will be at the Great Lakes Paranormal Conference in Glenbeulah at the Glenbeulah Haunted Schoolhouse. And that is also in Wisconsin. Yeah, so sorry, guys. I'm a little emotional. So thank you all. And getting the emphasis off of me, I'm going to bring out my guest. Matt Anderson, Dr. Matt Anderson is going to come out, and we are going to be talking about pain and how trauma and consciousness are related to physical pain and what you can do about it. Hi, Matt. Welcome.
Thank you. Well,
oh my gosh. All right. So let's start with, sorry, I'm still leaking a little here.
You are just fine.
So we had talked last week, I think it was, and I have my notes here because, I'm not going to remember much of anything that I talk about lately. So I wanted to talk about starting with the spiritual awakening that you had told me about. So could you share a little bit about that with us and how that led into what we're going to talk about tonight? So
yes. Well, like most things, things are okay until we find out they're not.
Right.
And that was most certainly my experience. I thought I knew who I was, why I was here, and where I was going. And thought I had things figured out, and had been very dedicated and very focused on a clear plan moving forward. And then I was shown otherwise. So much of this stems from, and then it really opened up my awareness and viewpoint of what is consciousness. Consciousness is very much that time when you have choice A or B, carry on status quo or completely change your viewpoint in your life. Throughout much of my life, if given two paths, path A is going to be the smooth sailing and easy and everything's going to be wonderful and good. And path B is going to be rocky and treacherous and full of challenges. For whatever reason, path B, I go every time.
I think that's a pretty common thing among spiritual people. We tend to choose the hardest possible way to do things.
Why not?
Yeah, right?
Yeah.
More experience, I guess.
And so really what happened is, just as I went further into what I thought was the path that I was meant to go on, things just were not aligning. And I kept facing more and more challenges and more obstacles, to where everything was essentially turned upside down and my viewpoint completely changed. And most certainly pushed me far outside of my comfort zone. I never would have thought that I would be talking on a podcast ever, first of all, and let alone on a topic like this.
Right. So because your background is medical.
Yes. So
okay.
I am a physical therapist. I've been practicing for going on 16 years. And my focus clinically has largely been on treating pain and chronic pain and complex conditions related to neck and back pain.
Okay. All right. So that's a big chunk right there. And then you throw in the consciousness piece. And yes. You've gotten some more training in a little less technical healing.
We could say it's less technical,
but it really isn't. Yeah,
not at all. If anything, I would say it's more complex because there is healthcare comes with this really cool thing called an anatomy atlas, where you can open that book and you can find structures, and there's terms, there's labels, there's a lot of guidance and established pathways to follow for what we know as healthcare. When you get into the spiritual metaphysical realm, that is largely uncharted territory in many means, where we are just barely scratching the surface, and it changes constantly, and there is no one size fits all.
Right. Absolutely. And it's interesting because when I started doing Reiki 20 some years ago, almost nobody had heard of it, at least not in the United States. And now Reiki is the word that we use as a general term for energy healing. So I think that there's become some more, at least acceptance, if not full understanding of what that is. So when you add in the energy healing aspect to your physical therapy aspect, how does that different for your patients, do you think?
That's interesting. I first was exposed to Reiki when I was in grad school. I had a professor that was a Reiki practitioner, and she had mentioned it to me. We were just having a conversation, and she had mentioned that she was a Reiki practitioner, and I'd never heard of it. I had no idea what it was. And I was asking her, and she was explaining it, and I thought, well, that's really interesting. And then when I was doing my clinical rotations, I was at an inpatient rehab hospital, and there was a family member of a former patient that came and spoke to the medical staff, and I was able to attend that. And she was a Reiki practitioner, and her sister had been in a really bad accident. She had a pretty significant head injury and was on the rehab unit. And she had talked to her physician about Reiki and said that she was a Reiki practitioner, was something that she wanted to try, and was he in support of her doing that? And surprisingly and wonderfully, he said, absolutely, you go right ahead. And she shared the how much it accelerated her recovery and the changes that they saw. And I was interested. My time in academia was very rigid, very science-driven, especially graduate school. And I had a professor that if he knew I was here right now talking like this, he'd probably try to take my diploma away.
I have a feeling there's probably more than a few of those out there, but yeah.
And it was very regimented in science, and don't you dare think or go to anything beyond it. And even things that were still science-based but a bit fringe were dismissed as quackery. And so it was, I tried very early on to maintain an open mind, whether I understood it or believed it or really felt the science supported it. Who am I to question or judge? Right. So maybe there is something, and why not leave that possibility open?
Right.
And that was my understanding of Reiki. And then I kept, as I continued on in my clinical practice, very focused on advancing my skills in manual therapy, doing a lot of continuing training and coursework. As I mentioned, in terms of going into this whole spiritual awakening, I had this idea that, go to college. That's what I was told. Go to college. That's all you need to do. You're going to get a great job, and then life's going to be fantastic. There will be no major, and any obstacle that you have, you're going to be in a much, much better place to do it because you're going to have this degree. If you have a degree, you've got job security, and therefore you have money. And then if you have money, everything's wonderful and good. And I ate that up and embodied it in full and took it times 10. And what a delightful misconception, and how quickly I was corrected. I graduated $140,000 in student debt. This was 15 years ago. That was a pretty substantial amount, still is.
Yes.
But it was incredibly overwhelming and daunting. And then my thought process was, because of the debt load, my aim was, I need to get rid of the student debt. It's basically, it's the ball and chain that is confining all aspects of my life. So became a workaholic and took on not just one job, but 2 jobs, and at times 3 jobs. And then I started working in a private practice and saw the lifestyle the owner was living. And I thought, well, I need to own my own clinic, because then that way I'll see a better financial return on the work that I'm doing. And then I can pay off my student loans, and then I can finally live. Then I can live, then I can be happy. So I did get the opportunity to go into private practice and own my own clinic. I have for nearly 8 years now. It didn't go that way. It was challenge after challenge. Led to working more hours and more hours and more hours, no personal life. And things really started to suffer all the way around. And then as things kind of started to crumble and fall apart, I kept hearing about Reiki. It kept coming in again and again, and including the receptionist I had at the time told me that she was actually going to study Reiki and was planning to leave her position to be a practitioner. And then I had met several patients that I really respected and held in high regard that I found out one was a Reiki practitioner as well. And then I had another patient that mentioned a relative of hers that's a Reiki master. And I was talking to her about it, and I said, I keep hearing about this. I need to learn more. And she told me, you need to go see her. Her name is Audrey Van Way. I call her she's the godmother of my spiritual awakening. And
and a wonderful person to boot. I know, because
absolutely.
I know Audrey. She's lovely. Yeah.
Yes, she is. So I scheduled a session with Audrey during a really rough time, really, really stressed. Things were not going well. And I walked into her treatment area, and she looked at me and she says, "You are under some stress, my friend." And we talked, and then I had the session, and I could not believe what I could feel. Even when I wasn't watching, I knew exactly where she was and exactly what she was doing. And it was the most incredible experience I think I've had. And I was talking to her about it, and she told me, she said, "You have a lot of awareness. You're energy sensitive. You can do this. You should do this." And I said, "Okay." And a month later, I took my first Reiki level 1 with Audrey. And what was really interesting as I talked to her more and more, and how she uses it, what she feels, what she senses, and as I learned more about Reiki, is how much I was already utilizing it in my practice, but I just didn't know it, because I didn't know that's what it was. I didn't know. I knew I felt things, and I heard things from patients too. And many perceive energy as heat, and can feel the warmth. And I had numerous patients that would constantly comment, like, "Why are your hands so warm? Oh my gosh, I can't believe the warmth." And one person dubbed me heater hands, and then angel hands, and God is in your hands. There's something going on here.
Yeah.
And I didn't know or recognize it. I just thought, I don't know, I'm just doing what I was trained to do in terms of the techniques, and this just happens. And I tried to explain it and rationalize it that, I'm very focused on what I'm feeling, and being focused on what I'm feeling, increased blood flow to my hands for the sensory awareness, and that's what you're feeling. But no, it was so much more than that.
So much more than that. Audrey popped in here. It says Facebook user, but I can tell by what she wrote that it's her. "You guys are too sweet. Thank you, Matt. You are talented beyond belief." And I actually only met you in person one time for a few minutes. You've never done a treatment on me, but I could feel that coming off of you, which is why I asked you to be a guest on my show, because I could feel it coming from you. I could feel that warmth. And I don't mean in sense of heat in this respect, but just that warmth as a human coming off of you. And just the way that, I don't know, you just have this glow about you in person that just says, "I'm here to help." I was very drawn to that.
Very much why I feel I'm here.
Yeah, absolutely. And I don't know if you have been watching this chat room, but boy, have they been busy. So I just want to acknowledge some people, because you guys have been great through like the last everything I've gone through. So I'm just going to go down the line here. Jessica, Jennifer, Courtney, B, Lee, Sherry, Ane, Courtney. Oh, I already said Courtney, but hello, Courtney, Kevin, Stephanie, Tristan, Rhonda. Let's see who else. Keith, Jessica, Keith, Lee. Okay. Audrey, Mary Kay, and Dee. Tammy Jean. Hi, TJ. Thanks for jumping on here. I was just on her Facebook Live a little bit earlier. She's a wonderful reader too, as well. So I just want to thank you all for your support and all of your humor. Like, Christina's leaking. Someone get her some Depends. Thanks, Lee. She can always make me laugh. She's just become a wonderful friend. And Marilyn has jumped on. So I want to thank you, all of you guys, for being here and being supportive, and introduce you to Matt, because he is a wonderful human being and a very talented healer. So a lot of these people are on here because of the consciousness aspect and your research and study into how consciousness and trauma are directly related to physical pain. So can you tell us what you've learned about that? Because that's been a hot topic in my women's group, which is where TJ and Marilyn have come from, is that online women's group that we have. And they're very interested in that. So, yeah.
Me too. Pain as a whole was something that I was drawn to right away. Always, being very empathic and aware of other people's pain and suffering, and knowing I wanted to be able to do something to help in any way that I could. And then stepped forward and said, I'm here, use me. I'm here to be of service and receptive to help in whatever way I could. And then that's kind of how I went forward. When I started my clinical practice, one of the things that I saw is far more experienced practitioners, and these were the attendings and my clinical instructors that I studied under, were extremely uncomfortable with people in acute pain, acute distress, didn't know what to do with them, and made them very uncomfortable and like, ooh, I don't want to do that. And I was in one of my first clinical rotations, and there was a patient that came in with really severe low back pain. And everybody's like, I don't want to touch that. So here I am, the student, no experience, and I'll do it. So I ended up taking that on and working with that patient. And then what happened is I started out utilizing the skills that I had learned in school and did it. And I just, I'm seeing some benefits, some results, but I just wasn't satisfied with the results that came from these techniques, and thought there's got to be something better. And I was fortunate. One of the instructors that I worked with had told me of a really highly regarded PT. He's no longer practicing now, but he's retired. But so you need to check him out. If you want to do this, this is the guy you need to learn from. So I was fortunate. I was able to take a few of his classes, and he served as my mentor and really helped guide my skills development. And so one of the things that became very clear is, first of all, pain is a very complex, very broad term that is extremely poorly understood, especially by most healthcare practitioners, and makes many very uncomfortable. And with that, it went into continuing to find, okay, how can we modulate this? How can we be more successful in managing pain? Well, then you have acute pain, you have chronic pain, and it behaves so very differently. And then the next thing is extremely subjective, varies tremendously from person to person. And so what I began to recognize is that pain is very much, it is an experience. And so we have this perception of, we have experiences, we feel pain, and I didn't learn this when I was in school, but there is no such thing as a pain nerve, pain fiber, or any type. Pain is solely an experience within the brain. So our brain receives sensory information from the body, and it interprets that information, and then based on that interpretation will determine what to do with it. One of the outputs from that interpretation of that sensory information that comes in is the experience of pain. So pain is an experience. Okay. And it is an interpretation, again, that results in that experience. Now, with that, that doesn't mean that all pain comes from injury. Or if you stub your toe, somebody drops a brick on your foot, you expect that's going to hurt.
Right.
But then there's instances where you're sitting and everything's wonderful and good, and all of a sudden you get this sharp stabbing, shooting, searing pain. Well, what the heck is going on there? And then just how the experience of pain changes, how you go from an acute injury and recent onset of pain, from the brick on the foot, and then next thing you know, it carries on, and it carries on, and it carries on, and it gets worse and worse and worse. And when I started my clinical practice, it was very early in the opioid epidemic, with the opioid crisis, the overutilization of pain medication. And so what it was is, anybody had pain, you go see your doctor, tell your doctor I have pain, and they give you prescription pain medication, and then expect the pain to go away. And you do that, you get that pain, you get that medication, you take it. And for some, it works. Some it dulls it, and others it doesn't quite do much. And the pain continues. It continues. And science tells us 4 to 6 weeks, a tissue injury should heal. And after those 4 to 6 weeks, the tissue trauma from that injury is in theory healed. Therefore, you should not be experiencing pain. And if you go and tell your doctor, I continue to feel pain, they say, yeah, it's healed. You shouldn't be. It's in your head. What's going on? What are you really looking for? Are you a drug seeker? And then basically dismiss people as being crazy. Yeah. Or they'll continue to elevate their pain medication, add more medications. And then now, for many, not only is their pain not better, it's worse. They're having all these side effects of the medication. And then all of a sudden, the doctor says, well, wait a second, you've been on all these meds for this amount of time. We can't prescribe anymore. And we're done. And now people are left addicted to pain medication.
Yeah.
Scared. And again, worse pain.
Right.
So what's going on here? And so then much were dismissed as it's all in your head. It's, and really feeling like the providers are telling them that they're crazy. And so that led to the whole consciousness aspect of pain and how we identify with pain. And then patterns I started seeing too in people that were having more significant and chronic pain, especially elevated levels of chronic pain, tended to have a lot of other things going on in their lives. The more stressed people were, the more complex I found them to report their pain to be. And so there was very clearly a link of emotion and stress to the pain that's felt. And so I just saw somebody posted a comment about, or they tell you to lose weight.
Yeah.
Let me tell you, have I had many patients that were told that?
I've been told that.
Yeah. Well, I mean, it's easy because I don't know what to do for you. So I don't know, here, lose weight. Exercise.
It must be because you're overweight.
Yes. Or the one that really gets me is, well, you're not as young as you used to be.
Yeah.
So because you're
that's so frustrating.
Or 50 or 60, then
well,
of course you're going to have pain. What do you expect?
Mm-hmm.
And just very dismissive. And I really try to listen to my patients. What a concept.
Can I just add? And if you're female, it's even more condescending.
Very much. Absolutely.
I don't mean to be like, I don't want to put us all in victim mode here, but seriously, if you're a female, good luck having your doctors listen to you.
I had one patient that told me that her doctor told her that she was crazy. It was all in her head and she needed to get her shit together. I don't know if I can say that. Sorry. That's
okay. We're not censored here. Knock your socks off.
Uh-oh. Watch out now.
Can I just say some hellos here? Because we missed some people. Danny, Marcy, Nikki. There's some more people in here. Shell, Marilyn, Keith, Mary. Okay. I think we got everybody. Hello, everybody. Thank you so much for being here. You're listening to Dr. Matt Anderson, who is a physical therapist, doctor of physical therapy, a Reiki master, and I know I'm missing something. ESM is...
it's a recent certification that I did. It's called Earth Spirit Medicine.
Oh, nice.
Diane Littell of Earthways Healing offers this. And it's a year-long training that explores shamanism. So it's largely founded in shamanism, but from a tribal aspect of where she blends things from her background. And her training was in Celtic. She has European descent, but also Native American. So brings in a lot of the Native practices in terms of the spiritual realm.
Awesome. And Valerie jumped in here too. If I had $1 for every time I was labeled a hypochondriac. Yeah. So these are the things that we are addressing tonight. So I'm glad that you're all here with us. So what is the conclusions that you have come to about how trauma and consciousness are related to chronic pain or even acute pain?
Yes. So much of it is that the medical model grossly oversimplifies the pain experience. Mm-hmm. And pain is an experience, first of all. Pain is a symptom. Pain is not a diagnosis. And pain is multifactorial, and it varies for everybody. And it shouldn't be judged. It should be respected and taken seriously. And ultimately, medicine is very focused on compartmentalizing and is very diagnosis driven. And this is the allopathic model of medicine, Western medicine. Mm-hmm. And what we do is when we find a problem, we need to determine what part is it? Where is this stemming from? What's the label that we put on it? And then we treat that label, that part, largely treating the symptoms of dysfunction of that. And it really robs the person of who they are and what they are, and being so much more. It would be like, we want to treat people as machines. You come in with low back pain, and we look and we do an MRI, and you know what? You've got some degenerative changes here, here, and here, bulging disc here, here, and here. So we're just going to take your muffler out, give you a new one, and you're going to be good to go. Well, it doesn't work that way. It does not work that way.
It does not. No, I can attest to that from personal experience. It does not. Also, Mary and Maureen, welcome. And we're going to hold you, if you could just put a pin in that right now and hold on to that. We're going to take a commercial break, and we will be back. Thank you.
The Body Code is a revolutionary method of energetic healing developed by Dr. Bradley Nelson, which allows us to quickly and easily identify specific imbalances that seem to underline chronic ill health, acute and chronic pain, and discomfort, dysfunction, and stress. Ellie energetically connects with the subconscious of the client. Psychic medium Ellie Weisensell is a medical intuitive and energy healer, and a certified body code practitioner. She identifies and clears energetic imbalances within the body and energy field. Contact Ellie at the website below, and Ellie can work remotely from a distance, by phone, online, video chat. There's no need to travel to an office. Remember, the Body Code is safe for humans and animals. Contact Ellie today.
Hey everybody, welcome back. You're listening to Be the Change Radio on WLTK-DB. I'm your host, Christina Bloom, and we are here with Dr. Matt Anderson, who is talking to us about the connection between trauma, consciousness, and pain, physical pain. So we would like to get right back into what you were discussing right before we went to break, and kind of really bring that connection together.
Yes. So let's get to the good stuff. Consciousness.
Yes. Consciousness.
Where that comes from and how I've gone into that direction is it's become very trendy and to say body, mind, and soul. We are going to take care of you, body, mind, and soul. You see it everywhere, and it's part of the mission statement, the focus, and so many different avenues. And it's really used without a lot of awareness or attention to what that actually means.
Right, I agree.
And it's great if we can embody that and actually fulfill it, but I get the impression that many do not really understand what it is, and it's just a saying. And this is where the consciousness aspect comes in. So body, mind, and soul are three separate entities. You have the body, the physical body, we have the mind, the brain, and then we have the soul, the higher self, the source energy. And the recognition that there is an interplay between all three of these. True health and wellness, all three must be in balance. If there is a lack in any, a person's going to feel that in some form. And that's where consciousness comes in. So consciousness relative to pain is consciousness, to simplify, what do I mean by consciousness? The definition that I prefer for consciousness is awareness. And awareness in all forms and in many things. But with that, when you get into the spirituality aspect of things, which can be really tricky and delicate and hard, because then of course that steps on the toes for some of religion. And then do they coincide, and are they complementary, and can we address them? Oh my gosh, can we address that in healthcare?
Okay, continue. I'm with you. Go ahead. Yeah, I'm with you.
So one of the things that I've come to appreciate is this is well studied and documented, that the majority of people believe in spirituality in some form, and do recognize and have some belief in the soul, and the soul being the higher self, the true self, that which beyond death of the physical body carries on. The majority do believe in an afterlife in some form. And so that is the higher self that is not dependent on the existence of the physical body. It existed before, it'll exist after. And then we have this thing called the mind, which is easily recognized as the brain, but it's more than a brain. And what I've come to believe is that the mind is the interface of the soul and the physical body. That is what enables the soul to inhabit and take on a physical body. We are not our body, we have a body. And the mind is a link that allows that to happen and joins the two. And it is very much from an energetic standpoint. That's how Reiki was such a natural flow for me, or it made sense. And with that, pain really comes into the emotional realm. And emotions are experienced within the body. And that's interesting, is emotions are an energy that are experienced and held and felt within the body. And one of the things with consciousness then that comes with consciousness and the awareness is this whole concept of awakening and then programming. I'm jumping around a little bit here, but programming is basically the set of definitions, ideals, teachings, things that we operate by, the beliefs that we hold as a society, as a family, and then as individuals. And with that, it can create a lot of conflict. One of the commonly held beliefs through the programming that we're taught to operate within is that emotions are dirty, emotions are personal, emotions are ugly. Displaying and acknowledging emotions is vulnerable. You expose yourself. There's no going back once you do so, and then you show yourself as weak, as flawed. Oh my gosh, as human. And so then much of what we do is we push down our emotions. And there's a wonderful psychiatrist that I really, really highly respect. His name is Gabor Mate. And he speaks very heavily on this and trauma. And so he talks about how we're taught emotions are personal. And you hold them, you hold them within. It's personal. You don't share that, and you push it down. And to push down is to depress, which then can come out as depression.
Yeah.
Much of which is unprocessed emotion, trauma, unprocessed emotion that's held within the body. So then what happens is emotion and pain as an emotion is held within the body, and it meets where the brain and body unite. And that's our experience of it. So then what will happen is, if we do not acknowledge our emotions, and especially our pain as an emotion, it will exist purely in a physical form. And then it will start manifesting in many different ways, one of which is pain. And that can be physical pain, emotional pain, and it can then come out as health issues. And then that's where consciousness comes in, where it's the awareness of this. And when you feel pain, is asking why. Where is this coming from? What does this mean? What is this telling me? What is going on? And that's one of the things that I found particularly frustrating in the traditional allopathic medical practice, is that we don't do that. We look at pain again as a symptom, as a diagnosis, and we treat it directly by trying to get rid of it, largely from medication and procedures and surgeries if needed. And we often go into it truly mindlessly and really miss the boat. We don't look at the whole person and recognize the complexity of their story, their experiences, and how that all leads to their pain experience.
Mm-hmm. Yeah, it's funny because I've trained myself over the years as I've been going through my own process and having dealt with a fair amount of pain throughout my life. My skeleton isn't put together quite right. So, that as life has gone on has caused some pain. But I have noticed that the flare-ups in that pain come with emotional trauma. When there is a lot of stress in my life, when there is these last 2 weeks have been an almost constant headache, so it's like when there's all of that going on. But I've also taught myself, like, okay, where is the pain? How does it feel? And what's happening in my life right now that's causing that pain? And I've taught myself to think that way. And that helps me in both directions. It helps me to manage the pain, but it also helps me to deal with whatever that issue is. So I think that is such an amazing thing that I'm absolutely astounded that the medical community somehow has skipped right over that.
One area that is picking up on a little bit more that I've been particularly impressed by is psychology. So the mental health, behavioral health profession is really the one that's taking the lead on recognizing a link between our mental, emotional, behavioral health and pain and physical function and dysfunction, and how it truly is intimately connected in our physical health and in really all forms. And that is one of the first areas where I've seen it. And there's more and more coming out. One that many may have heard of is called the polyvagal theory. And that's one that really is looking at the interface of our mental emotional state and how it's then led to the physical expression in our body and in our health.
Right. So Jessica has a question. What do you know about arthritis and how to help it? My aunt suffers with that pain. I do too, actually. I have arthritis. So what do you know about it? Because, I'd like to just get rid of it.
Well, everybody does.
Yeah.
And this was one thing I was quite surprised by when I was in school, is that arthritis, actually, we can start seeing evidence of arthritis even in our early 20s. That if you do if you pull any random person off the street, and this was a study that was done, just randomly selecting people, and as early as the 20s, people started showing arthritic and degenerative changes in their spines. And so what is arthritis? Arthritis has to do with, essentially, it's the wear and tear of the cartilage lining of the joints. Okay. And then it can become many different things. So much of it is affecting the cartilage, the joint surface. But then when this carries on over time, you can actually get bony changes. So instead of a nice smooth surface, you can get what's called bone spurs, or osteophytes is the technical term, where the body will then start to lay down additional bone. And instead of a nice smooth round, it may become more square. You may get these outcroppings of bone that are an attempt to stabilize that area due to the repetitive stress that it experiences. And it's a very normal part of life. And one of the things that is challenging is I have patients that come in and say, I've got back pain. I saw my doctor, I had x-rays, and I eventually had the MRI, and I've got a bulging disc at L3, L4, 4, 5, S1, and I've got bone spurs, and I've got degenerative disc disease, and I have all this arthritis in my spine. No wonder why I hurt. And that there is a very poor correlation between imaging and the way a person feels. And this has been shown again and again in studies where you may have a beautiful looking MRI and have absolutely debilitating, horrific back pain. You may have a horrible looking MRI and have zero pain and full function. Now, there is that small percentage where the two overlap and connect, and that's where intervention makes sense, such as surgery in some cases. So arthritis very much is just a normal change of the body based on life and experience. And one of the things I tell people is that, when you look in the mirror at age 20, 30, 40, 50, 60, 70, the reflection changes. And at age 50, you recognize that you don't quite look the way you did when you were 20.
Yeah, not quite.
Why would we expect our MRIs or our X-rays to be any different?
Exactly.
Now, just because your skin isn't as tight or you've got some wrinkles or the changes that happen, does that mean that you're any less of a person, that you're any less functional, that you're any less valuable, that you're less capable? And yet we look at imaging in our internal bodies and see any of these changes, and that's our immediate conclusion. Right. And it does not have to be that way. So arthritis as a standalone by itself does not mean or guarantee anything. Everything varies. And as I mentioned with the inconsistencies is that wrinkles don't hurt.
Wrinkles don't hurt. They're not painful.
But the inconsistencies that just because somebody has really bad arthritis does not mean, or they show evidence of really significant arthritis does not mean they're going to have pain. And one of the biggest factors that I've found that really determines the amount of difficulty, stress that a person is going to have in pain with arthritis is really highly related to the amount of inflammation they have. The more inflammation, the more pain you tend to have. And the more pain sensitive our joints tend to be. Mm-hmm. And that, I believe, is a much more significant factor than the arthritis itself. So one of the things for people with arthritis and arthritic changes is if you manage your inflammation, you tend to have much less difficulty, much less pain. As we do get more significant amounts of arthritic changes, which does happen as we get older. The other thing is it's very much the move it or lose it. And if you continue to maintain your mobility, you will fare much, much better than one that does not. And I've seen that and learned that from so many of my patients. Some that have really significant arthritis, if they remain active and maintain their mobility, they tend to have far less pain and limitation. And they may still hurt, they may still have pain, but what many have told me is that if I work through that, if I do my stretching routine, if I do water aerobics, if I do yoga, if I do strengthening, if I walk, if I stretch, all these different things that are available to us, that I may be sore at the moment that I do these things, but as I carry on, it becomes less and less. I move better and better, and then my day goes on so much better. If I take a period of time where I stop doing those things, my pain gets much worse. So it doesn't mean that my pain's gone entirely, but my pain level is much less and I'm far more functional.
Yeah. I find that when I do stretching every day, I have less general overall pain.
Absolutely.
And it doesn't even have to be strenuous stretching.
Mm-hmm.
It can be gentle stretching, but it helps.
And I actually encourage people not to be strenuous. Especially with stretching, you look at yoga, for instance, it is very much a journey. You do not expect to achieve some of these high-level poses the first time you do it. And if you do, you're going to be humbled quickly. And yes. I have never been
Boom.
of force manipulation, of forcing the body to do things. I believe it's very important to work with, listen to your body, listen to what you're being told, and then you build and you work together and you gradually will get the results you're seeking by working with versus forcing, and provoke much less pain and distress in the process.
Right. I completely agree. Ane and I are on the same page on this because one of the ways that I bring down inflammation is to avoid eating grains. She does the same thing. And I don't know if it's the same I don't know that it's the same for everyone, because I think everyone has different inflammation sensors. But I've noticed that sugar and grains are two of my big triggers.
The anti-inflammatory diet is really key. And much of what is viewed as the anti-inflammatory diet is number one, sugar. Avoiding sugar. There's numerous studies and evidence that show sugar feeds inflammation and really promotes the inflammatory response. So minimizing sugar as much as possible is really important for pain in general, but including arthritic-based or degenerative pain. Right. The other big component is minimizing processed foods. That's another big trigger for many people. Yeah. And then going as whole food based as you can is a big factor. And when it comes to whole foods, basically it's just how can we get foods as close to their natural pure form as possible. And then from there, everybody has different sensitivities where then you can find what do I tolerate best, what works better for me than others. And for some, it is eliminating and minimizing grains, and things like gluten, for instance, is another big one.
And how much of that do you think is, I'm going to just, throw you under the bus here, but how much of that do you think is really pesticides as opposed to grains?
And that's one where it most certainly is a possibility. I mean, I would not dismiss it in any way. We know that there are a lot of studies that show the benefits of eating organic produce. And, they prioritize your organic produce by ones that you do not peel. Anything that could have direct contact with pesticides, those are the priority. That's the produce to prioritize organic if you're going to go that route. Right. And then there's all these concerns about genetically modified food, which is unfortunately a lot, if not most, at this point. And so how much of that is there? A lot of it, I don't think we know. We're scratching the surface. We're looking at it further. And the thing that I try to not jump too much on the conspiracy bandwagon, but what is so tricky is when you look at these studies that are done, who's funding them? Who has the money? Who has the money to fund these studies?
Always follow the money trail. That's really where it goes every single time. Follow the money trail. And chlorine, pollution, fluoride. Yeah.
Yes. And you will often find that when you're looking at the interpretation, the results of the study is who paid for it, who funded it, to know whether it's true. And someone commented big pharma. Yes. Pharmaceuticals are a huge, huge source of funding research. The government is another big source. And what are the motivations there? Not that I'm challenging or questioning it specifically, but one of it is always, what are the motivations? And it was interesting. I was talking to someone that shared when they were working on their PhD doctoral thesis, and they were working on interpreting the data from their studies. Mm-hmm. One of the things that the university did was they paired them with graduate students that were studying statistics. And she shared that when she met with the statistics department, when it came to interpreting the data from her study, the first question they asked her was, what outcome are you aiming to support? Mm-hmm. And then we will find a way to manipulate and determine the statistics that support the desired outcome. Right. My statistics professor in grad school shared the quote, damn lies and statistics. And it's crazy how much you can manipulate statistics. So studies are a tricky one. First of all, we don't have enough of them. And then part of that is those that tend to go into it with more altruism, who's funding them and where's the funding coming from? The other thing is we tend to grossly oversimplify the complexity of these things. And we look at the specific foods, for instance, as triggers, but not why. Is it the quality of the food? Is it pesticides? Is it the way the food was processed or handled or packaged? Is there contamination from the packaging, from plastic packaging? who knows? There's many possible variables. But the other thing is what may be going on within our bodies and how we're digesting and breaking down that food, and may that be the issue?
Right. Right.
And
There's so much complexity. And Courtney
sure.
asks, is the fluoride we give kids also bad? I can't speak to that. What I can speak to is that I have a severe reaction to fluoride.
And that's something that's getting more attention now too.
Yeah.
Is this, there's support of fluoride being beneficial for the teeth. But what about other parts of our body?
Yeah.
And so this goes outside of my expertise, but it is something that certainly I think many are familiar with, that there's growing concerns of should we have fluoride in our drinking water?
Yeah, I don't really think that's necessary, but that's just my opinion, and my uneducated opinion at that. So, there's so many different angles that we can shoot this at, right? So, what I wanted to get down to was the average public person with, a high school education or even a college education, if it's not in nutrition and medicine, we don't even know how to read those studies or interpret them. So we can look at what someone else is telling us is the result of a study, but we have to take their word for it because we don't know. We don't know how to interpret that information. In addition to not knowing who's funding it, we don't even know how to interpret it. So, we're all out here with whatever resonates with us, but we don't necessarily know what's true.
Absolutely. And will we ever? I don't know.
I have no idea. And there was Courtney asked another question that's kind of a flag question. So let's see. Let's see. High current comment. So we're just going to throw you under the bus again, and you may or may not even have an answer for this, but here we go. I'd like to hear your point of view on vaccinating children. Is it completely necessary?
That's a tough one.
Yeah.
First of all, coming from my training, so as a physical therapist, physicals do not prescribe medication. So in terms of vaccinations, that's most certainly outside of my scope of practice. In terms of personal release and practices, I was more prone to accept things at face value based on what we were told the science shows and supports, and was certainly more open to vaccinations. I have 2 kids. My kids have had numerous vaccinations. I felt that from my awareness, from discussions with their pediatrician really is where much of it came from, that I trusted. Together, I shared my concerns, and then she shared her expertise and her training and her knowledge. And then through that, we made that decision together. So that's one for anybody that is concerned about vaccinations for themselves, for their children. I think it's really important that you need to have providers that you trust and that you can have that discussion with, where you can make the decision that best, that you're most comfortable with, and that you can get your questions and concerns answered. And you need to trust that person. If you question the information or their opinion, then that's probably not the right person for you. So you should find someone that you do feel better about. And when you look at some of the vaccines, I feel good. I had them all as a child, and I do not regret many of them that my children have had either, because I did feel that the science did support it. And the discussions that I had, I did feel like it was the right thing to do.
Right. And it's really the decisions that we get to make as parents too, in doing the research or, talking to our doctors. And I vaccinated my kids too, after having a long discussion with the pediatrician and really feeling like I could trust what he was saying.
Yes.
Yeah.
And that's really what it comes down to, is that I'm not going to tell somebody whether they should or should not. That's not my decision. That's your decision. And you need to do what you feel is best for you and your family and your children.
Right. Absolutely. I want to thank you, Matt, for taking the time. You've shared a lot of great information with us, and I would love to have you come back on, because we barely scratched the surface here in an hour.
We could go for hours.
So much more. I don't know. Maybe we just need to do like a whole series. of shows where we just start talking about all of this stuff. Definitely the connection between consciousness and pain and trauma and pain. And I can see that with all kinds of people, and the people who are talking about their trauma all the time. People who are constantly focused on their trauma tend to have a lot more pain.
Absolutely.
Yeah, and that's something that I have noticed as well. That's something in my work that it's a matter of trying to work with the mindset and shift that and get people in a more positive mindset. The pain lessens in most cases.
Well, pain, again, is an experience within the brain from interpretation of information. And pain gets our attention.
It does.
And the more our attention is needed, the stronger that pain message is going to be.
All right. Audrey wants a series. All right. We got to let you go because I know that Todd has to be somewhere and we need to stop holding him hostage. Thank you so much, Matt. I will be back next week with Kim Pomeroy. All right. Have a great evening, everyone.
The truth is here and now on WLTK-DB Talk Radio at WLTK-DB.com.